Hello and welcome to our Gratituesday webinar. I'm Lynn Griefor, the Vice President of the McLaren Greater Lansing Foundation. Thank you for joining us today. If this is the first webinar that you've joined, welcome. The purpose of these webinars is to really dive into what McLaren is doing to transform care in our community and the role that the McLaren Greater Lansing Foundation plays in that transformation. The foundation's sole purpose is to support the hospital with programs, projects, technology, capital, and whatever really the hospital needs, we are here for them. Today, we are going to talk about how the foundation funded a brand new cardiovascular program that just launched and will make a huge impact on our patients and our community. We'll get to that in just a minute. Just a quick few housekeeping items. Please feel free to ask questions in the Q&A box and we will answer them at the end of the presentation. This webinar is being recorded and will be shared on our social media channels, and you will also receive a copy. And we encourage you to share that with others that may be interested in this content in particular, or just learning more about McLaren Greater Lansing and the foundation. Lastly, if you want more information about our most recent capital campaign, the Capital Campaign for Care, please visit www.mglcampaignforcare.com. And with that, I'm excited to introduce our guests. We have Betsy Felton, our Corporate Cardiovascular Service Line Director, on with us, and Dr. Sanjay Batra, a cardiothoracic surgeon, will be joining us as well. So welcome to both of you.
Thank you. Thanks for having us.
Thank you, Lynn.
Well, it's so great to have you both here. And I thought maybe we could just start kind of high level with what is the latest news about cardiovascular services that McLaren Greater Lansing has to offer.
Well, I think that's definitely going to be our TAVR launch that we're doing for McLaren Greater Lansing. It's bringing state-of-the-art technology with very, very skilled physicians to do this program. And I think Dr. Batra probably has a lot more to say about the TAVR program. So.
Thank you, Betsy. Absolutely. I think TAVR is one of the state-of-the-art programs that has come about and one of the great advances in cardiothoracic and surgery and cardiology, one of the few areas where we've combined experts in both fields to provide the ability to offer a new technology to our patients that may not be suitable or be able to undergo a traditional aortic valve replacement, either be due to their overall condition, their lungs, their kidneys, their age, their ability to recover from a major open heart operation. And so really we've made tremendous advances, and we're very pleased to bring this technology with some very, very experienced operators to the Lansing area.
So it sounds like it's a little less invasive than open heart surgery, and I'm assuming maybe a decreased recovery time?
Absolutely. So with open heart surgery, it's cutting open the chest, the sternum, and getting to that valve to replace it, which is a surgical aortic valve replacement. And the technology has advanced to do this femorally. So when you, Dr. Batra, when you're having the open heart cases with the SAVRs, what's the recovery time for that?
So while surgical aortic valve replacement has always been the gold standard for treatment of this disease process known as aortic stenosis, it does require at least about a 4 to 6 day stay in the hospital. And not only that, but the recovery is a 3-month recovery, for full functional recovery from a major operation like that. When we're talking about transcatheter aortic valve replacement, or TAVR as we call it, we're finding now that we're able to send 70 to 80% of people home the very next day, strictly with a little puncture in their little small hole in their groin from where the valve went in. And most of them are up and walking around and doing majority of what they like to do within the first week.
Now, is the TAVR program launching now here in our current hospital, or is that something that the community will have to wait for when our new campus opens next March?
That's
So
exciting.
yes, so we've been working very, very hard, Betsy, myself, and our whole team, for probably about 9 months now in preparation, rather than waiting for the new hospital, but to launch the program at McLaren Greater Lansing in the old facility. But we still have all the technology that we need, and most important, we've got a very experienced group of operators as well as staff to help us move this program forward. So we are planning our first case July 26th.
Yeah.
Oh, that's right around the corner. That's very exciting.
Yeah.
Very.
And, you mentioned that you have to have, the clinicians that have been trained in this, you have to have the right technology, the right infrastructure. There's lots of puzzle pieces. And one of the things I'm so excited about is that the foundation was able to contribute one of those pieces, giving the funding for basically the infrastructure and the startup costs for the program. And we're very proud that we were able to be a part of this. And I know our donors really appreciate when we can talk about tangible things that foundation funds can help with. And this is definitely one good example of that.
If I could just answer that to you, Lynn, is that the financial support that the foundation gave us for that startup gave us the ability to launch at the current hospital. And otherwise we would have waited, but we talked about this, and really it's 6, 7, 8 months down the road to get into the new hospital, and how many patients can benefit in that time frame by one, having it done, the procedure done, but also having it done locally.
Right.
We can send patients to McLaren Flint and who've been doing it a little bit longer, or to another McLaren facility, but it comes into, we wanted to make sure this was open for all of the community, so that the community can get back a healthier lifestyle and feeling better. So, and the foundation saw that vision that we had and was very, very supportive in that. And so without the foundation, we couldn't have started until the new hospital. So
well, there's no story that our donors like to hear more than keeping care local to our community. Because you're right,
absolutely.
We could send them to Flint and they would get wonderful care, but no one wants to leave the community, in particular when they're not feeling well and you've got family that probably needs to come with you and test and so forth. So anytime
Absolutely.
foundation funds can be used to keep care locally, we are happy to help with that. So
and you did, so thank you very much.
So another piece of equipment that the foundation funded was the digital mobile super C-arm. Can you talk about that piece of equipment and how it has changed the way that we provide care?
Sure. The C-arm was the one that we purchased and that the foundation purchased for us was state-of-the-art for vascular surgeons to actually see a very, very clear image of your vascular system while they're doing the procedure. If they're putting a stent in, they want to be able to make sure it's in the exact location, and you are only as good as the tools that you have in front of you. If you don't have great, visibility, we don't want to, start anything that would, be at risk for the patient. So before we started that program, we got the new C-arm through the foundation, and our vascular surgeons were able to, really have the state-of-the-art technology to improve quality of care for patients.
Wonderful.
So very exciting.
Wonderful. So I want to move on at some point to talk about what you're excited about in terms of cardiovascular services in the new hospital. But before I do, is there anything else about TAVR that either one of you would want to let our listeners know?
Well, I think, I would like to add, there's two parts to the TAVR procedure, and one is obviously having the experienced operators. And I think it's very important for them to understand that the physicians that will be embarking and doing the procedures at McLaren Greater Lansing have all been involved in all the national TAVR trials from day one. And so it's a very, very experienced group. But the second part of it is, as you touched on earlier, is having the facilities, the complete facilities and state-of-the-art facilities to be able to do these procedures in. And that's where we're certainly very grateful to the foundation for helping us get, rather than waiting another 9 months until we got in the new hospital, helping us get the funding that we needed to get the like you said, the infrastructure built and all the various variables that we would need to move forward. And I think we started off with a checklist or to-do list of about 50 to 60 items, and over 9 months we've accomplished every one of those. And it's only after that that we all decided that we're ready to go live. So we're very excited for this program to get started.
I think that the prevalence of aortic stenosis is important to talk about too, and some of the side effects without having this done. Dr. Batra, I know you probably are the best to talk about the aortic stenosis, rates, and also, how they're feeling when they're coming to see you pre-TAVR, but also how they're feeling after.
Sure.
Maybe you want to speak to
So
that.
yes, absolutely. So aortic stenosis really is, something that people cannot avoid. It's just a part of getting old and the valve becoming what we call degenerative, where the valve becomes hard and calcified and the leaflets just don't open like they did for the previous 50, 60, 70, 80 years of your life. And so when the valve doesn't open well, the heart has difficulty pumping blood through that opening. I know the opening, we tell people, is normally the size of a quarter or a $50. And by the time that they come to us and are having symptoms, the valve is only opening about the size of a pea to a dime. So the opening is small, and it's like having to get water through a hose that has, a knot in it. And until you remove the knot, water's not going to get downstream. And so, unfortunately, these can be very disabling conditions. People are very, very short of breath, especially with exertion. They can have lightheadedness, dizzy spells, syncope, we call it, and they can also have chest discomfort. But the most common is shortness of breath with exertion. And they slowly recognize that they're not able to do the activities that they used to, 6 months ago, a year ago. Yeah. And so until the valve is replaced, that's when they are able to finally feel better. And I think it's very important for patients to understand that in this disease process, symptoms don't keep getting worse like you do when you have a blocked artery. A blocked artery, when it's 80%, you may have problems with exertion. When it's 90%, you may have some pain when you're at rest. With this process, you start to have symptoms, and we know that from all the major trials that there's a 50% chance of sudden death within 2 years of having symptoms. When that'll occur, nobody knows. And so it's very important to have your valve evaluated. And if you do have aortic stenosis, the physicians will be able to tell you when the valve is getting tight enough, also combined with your symptoms, and that it's time to have the valve replaced.
That's a great point for sure. And I think it comes back to the quality of life. People are having, Dr. Batra spoke about the shortness of breath. It's probably one of the first things that they're going to have symptoms with. And then that's when they're like walking around the house and they're still short of breath. So are they going to stop walking out to their mailbox? Yeah, they are. And then they're probably going to stop walking, which leads, there's a cascade of things that happens after that. You're not exerting energy, but not burning calories. And so then you could gain pounds, which is even more troublesome for the individual. So we really want to make sure that the patients have a great quality of life to do this. And I can tell you from someone who's not doing the surgery, to watch the dynamics between the cardiovascular surgeon and the interventional cardiologist and the multidisciplinary team work together, and 4 eyes looking at this instead of just one doctor. You got 4 eyes, and they're coming together with the plan, meeting with the patients, so answering the patient's questions and coming up with an individualized plan for them. To me, that's probably the most exciting things of having those two people connect and bringing the patient in with that. And it's just not much like it around. It's very, very exciting.
Yeah.
It's excellent technology. And I just will add one thing that nobody should feel that they're not a candidate for this. I mean, they should be evaluated. We've done, numerous patients between the age of 95 and 100 that have done very well and have gone home within, if not 1 day, 2 days.
Wow, what a huge impact that this is making on the health of our
Really
communities.
is.
Makes me proud, makes me very proud.
We're very thankful.
So one of the, I guess, once in a lifetime for most of us opportunities that we've had is to design a brand new hospital, a new healthcare campus from the ground up. And so can you talk a little bit about what cardiovascular services will look like, or how it will be different perhaps when our new hospital opens next March?
Yeah, I mean, I definitely can. We were lucky enough to go on a tour of the facility. Dr. Batra and his team and myself and a large group of individuals, and to look at where we're going, into the space that we're going. Currently, patients go to a doctor's office for Lansing, maybe over on Jolly Road, and then they have to come back over and meet with, at the medical office building with, the cardiothoracic surgeon and the cardiologist. This now, the new demographics in this is connected right to the hospital, the testing, the doctor's office, the cardiothoracic suite, and then also connected right to the hospital. So it's a one-stop shop. You're able to do that. You're not driving all around. You're not feeling good, so why would you want to drive all around either? So how it's been laid out has been very thoughtful and intentional to think of those patients so that they can go from the doctor's office right to have their echo, or they can go to the doctor's office and go right there to have lab testing, their echo, and their consult, all in that same building. And that's the same building they're going to come back to have their procedure. And just the flow of it is very intentional for the patient's comfort and their ease.
Yeah. And I would suspect, Dr. Batra, that there's more opportunity for collaboration between clinicians with everyone being so close together.
Absolutely. As to what Betsy said, starting in the office facility, the offices are not set up where they're individual and on different floors or down the hall from each other. It's one big cardiovascular service line where a multitude of offices are right next to, within close proximity of each other. So if I need to get up and just walk 20 feet down the hall to speak to one of the cardiologists about a patient, there they are right there, or an electrophysiologist, say regarding a pacemaker, or one of our nurse practitioners who is involved with the care of in the workup of the patient. So it's really, like she said, it's been very thought out in a really a very good manner, and all in the best interest of treatment of our patients.
It's wonderful. One of the things that's been very exciting for me is how invested the community is in our new campus. And so I'm giving lots and lots and lots of tours of the new campus. And one of the things that we get a lot of questions about, people are very interested in, are the hybrid ORs. Can you talk a little bit about that and what that means for patient care?
So a hybrid OR is really, it's an operating room that functions also with full cardiac catheterization capabilities. So it's a combination of an operating room and a cardiac cath lab. And you have the ability to do a full operation if you needed to, and you have the ability to do a full cardiac catheterization or a stent or anything, because you have the fluoroscopy and all the modalities that are needed. And not only that, the size of the room is actually larger than either one of those individually. And so it really allows for us to have all the various technologies that we need in there, and the personnel, a room for the personnel. And it's the future of cardiovascular services is in the area of structural heart, which is what TAVR is, and that's just one valve. And we're working slowly now on getting involved with a couple of the other valves that they're making great research progress on. And so over the next couple of years, I think you'll see us at Lansing really being in the forefront of structural heart, shall I say.
Wonderful.
And if I could just add, Lynn, I think that, the new hospital, the thoughtfulness and intentional direction that we took is a game changer for Lansing and the surrounding areas. It really is a game changer to come to one facility that has everything you need and not running to a lab, not running here, not running there, up floors, down floors. It was really thought out very well with the patient in mind. And the ill patient in mind,
Yeah.
that needs some help. So that's very exciting for the community and the surrounding community.
Yeah, agreed. So one of the other areas I wanted to touch on, because I think a lot of people in our community maybe aren't familiar, but McLaren is very involved in cardiovascular research. Can you talk a little bit about that?
We have a very robust research service line that is hand in glove, whether that be in cardiovascular, vascular, oncology. Even with the COVID, trials, we were, leading in the research studies. So there's been a lot with heart failure. They're doing one at Lansing right now with a new stent process, new stent that they have on market. And this gives us the ability, because with companies, they're ever changing, right? To make better technology and to get that competitive edge. So we are able to get involved in these studies. And so when they come to, to the shelf, we are first in line to get that. If you're not part of the research, you are not going to be the first one. And there's some very exciting research coming out and product coming out next year that obviously I can't mention because it's not my company. But we're in that trial so we can be the state of the art for coronary and cardiovascular care. And so, there's CHF, there's coronary artery disease, there's heart failure, there's AAA, so aortic aneurysms, DVTs, pulmonary embolisms, just so many research studies. And that's just in the cardiovascular space that we've been doing, and continue to explore that and to grow it even bigger, which everybody's excited about when they have a really well-run IRB and research program to get this done, do it correctly, and make sure we are, on the cusp of every cutting edge that comes out.
Wonderful. Well, Dr. Batra, I'd like to kind of end with you. Is there anything else that you'd like to say to our community, to our donors about cardiovascular services at McLaren?
Well, I would. Probably the last thing I'd like to say is, if you go back 10, 15 years, 20 years ago, I think a lot of people, left the community to go to either Cleveland Clinic or University of Michigan for some of their major, valve procedures or major open heart procedures or, areas like that. And I think, what we've been able to do with the help of the foundation, with the grants that we've received, with the ability to bring in, some of the top physicians, around, some of the most experienced, that, in this day and age, there's absolutely no need to go anywhere but to, our institution to get the highest quality and the highest caliber work that can be done anywhere. And, we pride ourselves in the experience level of the physicians that we have been able to recruit and that we have working on all of our specialty areas now. So that would be my big last kind of synopsis to the community, that you're in great hands now at McLaren Greater Lansing.
Absolutely. And I probably shouldn't end this, but I am going to say, because Dr. Batra won't toot his own horn, he is one of the most experienced in TAVR in the nation. He's well known. People come to him for, hard cases, and they send their patients to them. He's the TAVR man. And I just coined him that. So he won't toot his own horn, but it needs to be known that they are getting where Cleveland Clinic and all these other people are calling him and asking him questions, they have that person right in that community.
Yeah.
So
No.
he's
Thank
awesome.
you, Betsy. But I will always say that it's the whole team that makes the program. So
And that's the great leader he is.
yes.
Well, very well put. I love when we get compared with places like the Cleveland Clinic because I don't ever want to leave the community if I need care myself. So I feel great about that. So TAVR man, Betsy, thank you both so much for joining us. And thank you, those of you that joined us live. And thank you to our donors for making programs like this possible and really bringing a whole new level of care to our community through your donations and support. We are excited to have you join us next month as we welcome Bill Beekman, Michigan State University Athletic Director, to discuss all things MSU and McLaren and of course football season. Next month's webinar is sponsored by Huntington Bank. So see you on August 24th at 3:00 p.m. Thanks so much.
Thank you.
Thank you.